Every year, millions of people around the world experience a stroke. What's truly heartbreaking is that many of these people never recognize the warning signs their bodies are desperately sending them. A stroke can strike suddenly, often without any prior symptoms, but in many cases, the body does send out subtle, urgent signals. Ignoring these warnings can lead to devastating consequences, because when it comes to stroke, every second counts. Today, let's take a closer look at 7 warning signs of stroke that you should never ignore. These symptoms are your brain's final cry for help. Recognizing them early could make the difference between life and death, between full recovery and permanent disability. The first and most common warning sign is sudden weakness or numbness on one side of the body. Imagine you're going about your daily activities and, out of nowhere, you realize your arm or leg feels heavy, clumsy, or numb. Or perhaps you notice your face looks uneven in the mirror, with one side drooping, or your smile becoming lopsided. This is one of the most recognizable and dangerous symptoms of a stroke. The sudden loss of control over one side of your body means that the blood supply to a part of your brain has been blocked or reduced. Even a few minutes of this can cause irreversible damage to brain cells. If you or someone near you experiences this, don't hesitate. Act immediately. The second sign is trouble speaking, slurred speech, or difficulty understanding others. You might be engaged in a conversation and suddenly find it hard to form words, or your speech becomes garbled and incomprehensible. Maybe you know exactly what you want to say, but your mouth just won't cooperate, or you find it difficult to understand what others are saying to you. This isn't just fatigue or lack of sleep. This is a warning that the language and communication centers of your brain are being affected. Don't dismiss it. Take it seriously and seek help right away. The third warning sign is sudden vision problems. This could mean losing vision in one or both eyes, or experiencing blurred or double vision. Sometimes it feels as if a curtain has fallen over your field of sight, or everything becomes hazy, like looking through a foggy window. Because this symptom can be painless and may only affect one eye, it's often overlooked. But vision problems can signal that blood flow to the part of your brain responsible for sight is being blocked. Immediate action is crucial to prevent permanent loss of vision and further brain injury. Fourth, watch out for sudden dizziness, loss of balance, or difficulty walking. If you feel unsteady, like the room is spinning, or you're staggering as if you've lost all sense of direction, especially if you haven't suffered any injury, this could be a sign of a stroke affecting the cerebellum, the part of your brain that controls balance and coordination. If these symptoms are accompanied by nausea, vomiting, or a sudden severe headache, the risk is even higher. Don't brush it off as just a fleeting moment of weakness or low blood sugar. It could be a critical warning. The fifth symptom is a sudden severe headache, unlike any you've experienced before. This isn't your typical tension headache or migraine. It comes on rapidly and with intense force, sometimes described as the worst headache of your life. This can be a sign of a hemorrhagic stroke, where a blood vessel in the brain has ruptured. If this headache is accompanied by neck stiffness, nausea, vomiting, or even brief loss of consciousness, it's an emergency. Call for help immediately. Sixth, difficulty swallowing or sudden choking while eating or drinking can also be a warning sign. You might suddenly find it hard to swallow, or you start coughing and choking with foods or liquids that normally go down smoothly. This happens because the nerves and muscles that control swallowing are being affected. While it's easy to dismiss this as a minor issue, it can be a critical sign that a stroke is affecting the brainstem or other important areas. Don't overlook it. The seventh and final warning sign is a sudden episode of confusion, fainting, or momentary loss of consciousness. It might feel like your brain has shut off for a few seconds. You become disoriented, lose track of your surroundings, or even black out briefly. This isn't just tiredness or low blood sugar. It can be the first stage of an ischemic stroke, where a blood clot blocks a major artery supplying your brain. Even a brief moment of confusion or unconsciousness should never be ignored. When you recognize any of these signs, remember the FAST rule, a simple, powerful way to identify a stroke quickly and accurately. F stands for face. Ask the person to smile. If one side of the face droops or the smile is uneven, this could be a stroke. A stands for arms. Ask them to raise both arms. If one arm drifts downward or can't be lifted, it's a red flag. S stands for speech. Ask them to repeat a simple sentence. If their words are slurred, jumbled, or they can't speak at all, this is a serious warning. And T stands for time. Time is absolutely critical. Call emergency services immediately. With every passing minute, millions of brain cells die, and the chances of recovery diminish. So, what should you do if you or someone around you experiences any of these warning signs? Don't wait. Don't hope the symptoms will go away on their own. Don't try to treat it at home or wait for a family member to arrive. Call emergency services right away. In the case of stroke, time is brain. Every minute lost means more brain tissue lost, and the window for effective treatment is very narrow. Getting to the hospital within the first 3 to 4.5 hours is the golden opportunity to save a life and ensure the best possible recovery. It's important to remember that stroke doesn't discriminate. It can happen to anyone, young or old, healthy or with underlying conditions. Factors like high blood pressure, diabetes, high cholesterol, smoking, excessive alcohol consumption, obesity, lack of exercise, chronic stress, and even sleep deprivation can all increase your risk. That's why it's crucial to maintain a healthy lifestyle, manage stress, get regular checkups, and be aware of your own health. But awareness is not just for yourself. Share this knowledge with your friends and loved ones. Sometimes, a simple conversation or a shared message can save a life. Encourage those around you to recognize these warning signs and to take action immediately if they ever occur. The sooner a stroke is recognized and treated, the better the chances for survival and recovery. If you found this information helpful, take a moment to reflect on how you can use it to protect yourself and those you care about. Make a commitment to learn the FAST rule, to stay informed and to spread awareness. Your efforts today could make all the difference tomorrow. Thank you for taking the time to learn about these critical warning signs of stroke. Stay vigilant, stay healthy, and remember, when it comes to stroke, every second truly matters. Take care of yourself and those around you, and never hesitate to act when you see the signs. Your quick response could save a life.